Hi, my name is Caleb, and today I'll demonstrate hands-only CPR and AED use. CPR and AED are life-saving skills used in emergencies to maintain blood flow and support the heart until emergency responders arrive. When someone is found unresponsive or has collapsed, CPR may be needed, but first check the scene safety. Ensure the area is safe to approach. Approach the victim and tap their shoulders. Are you okay? Check for normal breathing for no more than 10 seconds. If the victim is not breathing normally or is only gasping, begin the emergency response. No response is observed. If the victim remains unresponsive, point directly to two different bystanders if possible and shout, "You, call 911, and you, get an AED." If alone, call 911 immediately. CPR start. Place hands in the center of the chest and lock elbows. Position shoulders directly over hands. Begin chest compressions. Push hard at about 2 inches or 5 centimeters deep and at a rate of 100 to 120 compressions per minute. Allow full chest recoil before compressions. Continue uninterrupted CPR cycles. Remember to push hard and fast. Once the AED arrives, turn it on. Follow the voice prompts from the AED. If needed, the AED will tell you to take the two pads and place one on the patient's upper right chest below the collarbone and the other on the lower left chest. Remove any clothing in the way of the pads. Shout, "Everyone clear." Ensure no one is touching the patient. The AED will then analyze the patient's heart rhythm. If necessary, the AED will say shock advised. Deliver the shock while ensuring no contact with the patient. Immediately resume CPR chest compressions. Continue CPR at 100 to 120 compressions per minute. Do not stop until emergency responders arrive or the victim shows signs of life. If tired, get someone else, if available, to take a turn and give you a break. If the victim shows signs of responsiveness, continue to monitor the breathing and keep the airway open. If the victim remains unresponsive, continue CPR cycles until emergency medical services arrive. Maintain high-quality compressions and repeated cycles, continuing until help takes over or the victim regains responsiveness.